Good morning to you, to all those people tuning in, and good morning to Abdiel, who supports us from the studios. We begin the briefing by expressing the satisfaction of the Cuban people for the safe and uncomplicated arrival yesterday of the 52 collaborators who remained in the Lombardy region in Italy. As we said yesterday, this was the region with the highest transmission and the highest lethality of COVID 19. Our recognition, which is that of our people, the one made by our president in the reception yesterday, and we do hope that we will soon have them back with us, incorporated into their activities. Thank you very much for your work and welcome to the motherland. Today, as a gift for their return, we stress that it's already 10 days since we had the last death caused by COVID 19 in our country. This expresses what we always say, the prevention actions, the opportune admission. It tells a lot about the therapeutic behavior that is followed after the patients are admitted, and that ultimately, despite having several cases and several people who have contracted the disease, we have not had more deaths. 515 people are admitted to the country's hospitals, 12 are under surveillance, 263 are suspected, and 240 are confirmed. Our specialists and professionals monitor 607 people in primary healthcare system. Yesterday, our biology laboratories examined 2,067 samples. In the molecular biology of the Pedro Curie Institute, 1,068. In the Provincial Center of Hygiene and Microbiology Laboratory in Santiago, 282. In Havana, 281. In the Amejiras Brothers Hospital, 236. And in Villa Claras, 200. And as a result of the study of these 2,067 samples, 5 tested positive for COVID 19 for 0.24% of the samples studied. Thus, Cuba has already studied 122,603 samples of people suspected with the disease, and of them, 2,205 have tested positive for 1.8% of the samples studied. The 5 confirmed cases are all Cuban, and this is the pattern that have been going on for a while now. Of them, 4 are confirmed case contacts for a total of 1,941, that is 89.6% of all cases confirmed in Cuba, are positive case contacts. In one case, the source of infection was out of the country for a total of 157 people who have acquired the disease abroad, and we had no case in which the source of infection could not be determined. Nevertheless, we have 66 people in this category. Sometimes we are asked, how come if there are no foreigners coming in, we're having cases with source of infection abroad? I think that in our country, news reports have informed about the arrivals of some flights, and likewise, it's well known that everybody who returned to our country from abroad are transferred to an isolation center for travelers for 14 days. In those centers, these people are studied to rule out they have the disease, and as a result of that screening, in some people test positive. That is why we have one case today that has as a source of infection abroad. 3 of the cases are male, and there are already 1,111, that is 50.4% of the cases diagnosed in Cuba, Two are of the female sex with an accumulated of 1,094 for 49.6%. 60% of yesterday's confirmed cases, 3 of the 5 cases were asymptomatic at the moment of being diagnosed with the disease, for a cumulative total of 1,163 people, which is 52.7% of all confirmed cases. They have shown no symptom at the moment of the test. At a later moment, we will describe how these asymptomatic patients have evolved. By age groups, the group of 20 to 39 years, 3 cases, and from 40 to 59 years, 2 people. There are no children among the diagnosed people yesterday, so there is no change in the number of 244 children diagnosed with the disease in the country. And 89.3%, that is 217 children, have been discharged, and we ratify that all of them have had a positive recovery. 80% of the cases, 4 of the 5 cases are from Havana, and they are distributed in 4 municipalities. And one, which is the case that got infected abroad, is from Villa Clara, from the Villa Clara municipality. And allow me here to point out that imported cases do not increase the incidence of the province which they come from, because their infection is not a result of the spread of the disease in that province, but from their infection abroad. So it is imported. Thus, the infection rate, the positivity rate in the last 15 days, I'm talking about the incidence rate per 100,000 inhabitants, it remains with Havana with 11.07% rate, followed by Matanzas with 1.81, Artemisa with 0.97, and Ciego de Avila with a decrease with 0.23. And we reiterate that the provinces of Granma, Pinar del Río, Mayabeque, Villa Clara, Cienfuegos, Santi Espíritus, Camagüey, Las Tunas, Holguín, Santiago de Cuba, Guantánamo, and the Isle of Youth Special Municipality have not reported cases over the last 15 days. Today, of the 2,205 patients diagnosed with the disease in Cuba, 240 are still admitted in our hospitals as active cases. And also as a result of the efforts by our country, by the state, by the government, by the party, and our professionals, 239 patients, that is 99.5%, have a stable clinical course. This means that today we only have 1 case in serious condition who remain admitted at the Salvador Allende Hospital. And the 2 other patients who were reported in serious condition, they have shown improvements, and they are now listed in guarded condition. One is at the Salvador Allende Hospital, and the other is at the Pedro Curie Institute for Tropical Medicine here in Havana. 12 people were discharged yesterday for a cumulative total of 1,880 patients who have recovered, 85% of the diagnosed patients. This is a favorable indicator because, as unlike the two previous days, yesterday there were more discharges than confirmed cases. We always regret the death of 83 people as a result of this disease in our country, and it is the 10th day without death for a lethality of 3.76%. And with this lethality, Cuba occupies the 18th position among the countries of the region of the Americas, which currently has a 5.46 lethality. It is very high. And there are 17 countries with rates higher than Cuba's. I have to mention, and we will see that on a chart later, that the United States remains with the highest number of confirmed cases in the world, 1,942,363 cases. This morning I heard on the news that the number had already surpassed 2 million confirmed cases in the States, which is something possible taken into consideration at the time of the update. The U.S. is followed by Brazil with 672,846 confirmed cases. Peru with 196,555, Chile with 134,150, and Mexico with 117,103 confirmed cases, and the rest of the countries in the region have fewer cases. As of 12 o'clock last night, in the world, 185 countries continued reporting COVID-19 cases. The confirmed cases number stands at 6,960,259 cases. That is 124,536 more people diagnosed than yesterday, and 3,335 died in the world yesterday. 3,335 people died in the world yesterday due to COVID-19, accumulating 401,970 deaths for a lethality of 5.78. The region of the Americas already accumulates 3,349,334 confirmed cases, 69,202 were diagnosed in the region yesterday. This is a high number despite the evolution span of this pandemic, and the region accounts for 48.12% of the total cases that have been reported in the world. Yesterday, 2,227 confirmed cases died in our region for a total of 183,030 deaths, and that gives a lethality of 5.46%. I wonder if it's possible now to show with the projector a chart, graph showing the epidemic dynamics. There it is. Thank you very much. This is a graph that expresses the dynamics of the pandemic since December 30th. Is the first date that appears there until the cut until June 1st. What's interesting is the way it's changing. The red part, as you may see, was the largest at the beginning. That represents Europe. And the yellow part, that is the one that is at the top, is America. Notice how Europe, with the measures it has been taking, with the restriction measures, with the control measures, has been representing less and less the contribution it has made to the behavior of the pandemic. However, in a very significant way, the region of the Americas, which is the yellow part that is at the top, look at how it has been increasing, and now it represents a greater contribution, a greater number of confirmed cases, a greater number of deaths in the world, occupying this position. This is only to see the dynamics of the disease in the first place and to remember, as we always say, that it is a problem that although in our country we have some figures that we do not deny comfort us and that encourage us to continue working more and to continue taking measures, however, it is not the behavior that the pandemic is having in other parts of the world, and especially in our region, which is the region of the Americas.